Okay, hello everyone. Good afternoon. So we are from Group 1B. So today I would like us to discuss about one of our assignments from subject MDA 2011, Medical and Surgical Nursing 2, Gastrointestinal, Genitourinary and Renal. So we've been given a teamwork assessment, which is about 10%. So we'll be given a scenario and we will discuss the questions. Okay, so for Group 1B, we got a scenario of Nandam Nogaya, 39 years old with body weight of 100 kilograms, complains of colicky type flank pain, dysuria, and hematuria. She was admitted to the ward and several investigation was carried out. The doctor diagnosed her with renal stone and she was scheduled for a percutaneous nephrolectomy PCNL procedure. 4 questions here. So questions number 1 is list the risk factor of renal calculi. So does any of you want to take this?
So I want that question.
Okay, I know you're going to take these questions. Number 2 is how a patient with renal calculi experience hematuria.
I want a question. Can we share together?
Okay, alright. So me and Ame will take this question number 2. Question number 3, explain nursing responsibility before and after percutaneous nephrolectomy procedure.
Can I have this question with me?
Alright, okay. Which of you will take before and after?
Maybe I'll take the after procedure and me will take the before procedure.
Okay.
Okay.
Alright, it will be Umay and me. And last question is what preventive measures can Panogaya take to reduce the risk of recurrent renal calculi after the percutaneous nephrolectomy PCNL procedure?
Maybe since you and I are the one who doesn't have the task yet, so how about we share the patient? Okay. So we take it.
Okay, alright. So that's all I think.
Come along with me, and the butterflies and bees. We can wander through the forest and do so as we please. Come along with me to a cliff under a tree, where we can gaze upon the water as an everlasting dream. All of my collections, I'll share them all with you.
At the beginning, we discussed how to divide our tasks fairly and plan our progress according to each member's rank. Although it was our theory week, our class usually end at 4 p.m., so we made use of our time by discussing right after class or during assignment sessions.
Well, for me, managing time was one of our biggest challenges because even though everyone had a different personal commitment after class, so even though we're tired from a full day schedule, we still tried to meet after class to finalize our discussion and recording them.
We also face challenges in finding accurate nursing information about renal calculi and the PCNL procedure.
We encountered technical problems such as unstable internet, connection, background noise, and limited space for recording.
So for me, through the assignment, we realized that teamwork is not just about dividing tasks, but about supporting one another.
Every member contributed, whether in preparing the script, doing research, editing the video, or practicing the presentation.
We learned to communicate better, to respect each other's opinion, and help when someone was struggling. This experience also taught us patience, coordination, and the importance of teamwork, skills that are very valuable to our future as nurses. This teamwork assigned taught us more than just using the management of renal calculi. We take about 30 minutes to complete our 6 minutes video about explanation of preventive measure about renal calculi. We develop soft skills like time management, communication, leadership, and adapting. How about you?
Yes, I agree with you, Rashida. Even though we had a busy week, our determination and commitment helped us complete the task successfully. It was a meaningful experience that strengthened our friendship and teamwork.
Thank you guys.
Hi, my name is Anuradha Muhammadi and my matrix number is 24003131. Today I will be talking about renal calculi, or more commonly known as kidney stones, and the main risk factors that cause them. Okay, what are renal calculi? Renal calculi are kidney stones or hard deposits made of minerals and salts that form inside your kidneys. They can affect any part of your urinary tract, from your kidneys to your bladder. How they form? Stones form when your urine becomes too concentrated with crystal-forming substance like calcium, oxalate, and uric acid. At the same time, urine may lack a substance that prevents these crystals from sticking together. Okay, let's start with dietary and lifestyle risks. First, high sodium intake. Eating too much salt increases the amount of calcium your kidneys must filter, raising the risk of calcium-based stones. Second, high animal protein. Diet rich in meat, fish, and poultry can increase uric acid levels and lower urine pH, promoting stone formation. Okay, next is high oxalate foods. In susceptible individuals, a diet high in oxalates, such as spinach, nuts, can contribute to calcium oxalate stones. The last one is high sugar intake. Diets high in refined sugars and high fructose corn syrup may increase the risk of kidney stones. Dehydration. Low urine volume from not drinking enough water is the single most important risk factor. Concentrated urine allows minerals to crystallize more easily. Risk is also higher in hot, dry climates and with excessive sweating. Okay, now let's pivot to the factors we cannot always control, which is your medical history and genetics. These pre-existing conditions play a significant and sometimes recurring role. Now I'm going to talk about associated medical condition. The first one is personal or family history. Having a prior stone or a family history significantly increase your risk of recurrence. Second, chronic UTIs. Recurrent urinary tract infections can lead to the formation of specific stones such as thyroid stones. Third, gout. This condition marked by high uric acid levels is a primary cause of uric acid stones. The next one is genetic condition. Rare inherited disorders like cystinuria or primary hyperoxaluria cause the body to excrete too much of a specific substance. Next, digestive disease. Conditions like Crohn's, colitis, or gastric bypass surgery can alter the absorption of calcium and water. The last one is medication. Certain diuretics, calcium-based antacids, and high-dose supplement like vitamin C can increase the risk. Okay, now other contributing factors. First one is obesity. A high body mass index is linked to changes in urine composition and an increased risk of stone formation. Second, inactivity. A sedentary lifestyle or prolonged immobility can be a contributing factor to kidney stone development. Third, gender. Men are generally more affected than women, although this gap has been narrowing in recent years. Okay, the key prevention strategies is stay hydrated. This is the first way to prevent stones. Drinking plenty of water, 8 to 10 glasses per day to keep urine dilated. Second one is modified diet. Balance your sodium, protein, and oxalate intake based on your specific stone type and medical advice. The last one is medical advice. Consult a doctor to understand your specific risk and to get a 24-hour urine analysis if stones are recurrent. That's all from me. I hope this overview helps you identify and manage the risk associated with renal calculi. Thank you.
Hi everyone, I'm Ame. In this video, I will explain how a patient with renal calculi or kidney stones can develop hematuria, which means blood in the urine. Most people feel worried when they see blood in their urine, but in the case of kidney stones, the mechanism is actually very simple. Kidney stones are not smooth. They usually have rough, jagged, and sharp edges. When a stone is still inside the kidney, it might not cause any bleeding yet. But once the stone starts to move, especially when it travels down the ureter, that's where the irritation begins. The inner lining of the urinary tract is called the mucosa, and it is very delicate. So, when a stone with sharp edges rubs or scratches against the lining, it can easily cause irritation or minor injury. Right under the mucosa lining, there are many tiny blood vessels. When the stone moves and scratches the lining, these small blood vessels can break. Once the vessels rupture, a small amount of blood leaks out and mixes with the urine. This is why the urine may appear red, pinkish, or sometimes brown. Even if you can't see the blood, a urine dipstick can still detect microscopic hematuria. And that's the basic mechanism behind how kidney stones start causing hematuria. Now, Nasir will continue with a more detailed explanation. Bye-bye.
Hi everyone, my name is Muhammad Nasir. So I will continue the explanation on how renal calculi lead to hematuria. So when a kidney stone moves inside the urinary tract, it doesn't travel smoothly. Why? Because the ureter is actually a narrow tube. So, when a stone moves through it, it creates a friction against the ureter walls. If the stone gets stuck, pressure builds up behind it. This pressure, combined with a stone's sharp or rough edges, causes even more irritation to the mucosal lining. The lining becomes more sensitive, more fragile, and more likely to get injured. Because the lining is delicate, even small scratches can rupture tiny blood vessels. When these little vessels break, the blood mixes with the urine. This can lead to two types of hematuria, which is gross hematuria, where the blood is visible with the naked eye, and microscopic hematuria, where the urine looks normal. But why does it look normal? Because the blood is only be detected by dipstick or lab test. Both types are common in patients with renal calculi. Hematuria becomes worse if the stone is large, the stone get lodged in the ureter, there is inflammation around the kidney, or the patient is dehydrated. All these conditions make urinary tract lining even more fragile and prone to bleeding. So, in summary, hematuria occurs because the moving kidney stone scratches, irritates, and injures the urinary tract. This causes the tiny blood vessels to rupture and the blood mixes with the urine. And that is how renal calculi lead to hematuria. Bye.
Today, I will be explaining about the nursing responsibility before a percutaneous nephrolithotomy or PCNL procedure. First is verifying the patient's identity and confirming that the surgical consent form is signed. This ensures that the correct patient undergoes the procedure and that informed consent has been given. The second is obtaining baseline vital signs such as blood pressure, pulse, temperature, and oxygen saturation. This provides a reference point for detecting any post-operative complication later. The third is viewing laboratory results, including full blood count, renal profile, and coagulation studies. These help identify any abnormalities such as anemia or bleeding risk before surgery. The fourth is ensuring the patient is kept NPO for at least 6 to 8 hours before the procedure. This reduces the risk of aspiration during anesthesia. The fifth is administering prescribed antibiotics as ordered by the doctor. This helps prevent infection since the urinary tract will be accessed during the procedure. The sixth is checking for any allergy, especially to contrast media, iodine, or antibiotics. This prevents possible allergic or anaphylactic reaction. The seventh is assisting by preparing and shaving the flank area where the puncture will be made. This maintains asepsis and reduces the risk of infection. The eighth is educating the patient about the procedure, what to expect, how to cooperate during recovery. This reduces anxiety and builds trust between nurse and patient. The ninth is inserting an intravenous line for fluid administration and medication. This ensures venous access for anesthesia or emergency use. The 10th is encouraging the patients to void before surgery or insert a urinary catheter if ordered. This prevents bladder distension and allow monitoring of urine output.
Hi, my name is Sharifah Umairah binti Zainal Zaidi, and now I will talk about nursing responsibility after PCNL procedure. First, frequent monitoring of vital sign, level of consciousness and pain. Rationale for early detection of hemorrhage, sepsis, respiratory or hemodynamic compromise. And for point number 2 is monitor urine output separately from nephrostomy drainage. For example, record color, amount and character. Rationale, sudden decrease or change, for example, heavy bleeding, cassation, sickness, obstruction, hemorrhage or tube malfunction. For point number 3 is assess surgical or nephrostomy site for bleeding, swelling, redness or urine leakage. As a nurse, we should also maintain dressing integrity. Rationale, early signs of hemorrhage or infection permit prompt intubation. Next is maintain nephrostomy tube patency, such as ensure tubing is not kink, secure tubing and never ever clamp unless ordered. Rationale, clamping can increase intrarenal pressure, risk urine intravasation or infection, and cause flank pain, patency, prevent obstruction. For point number 5, manage pain with prescribed analgesic and non-pharmacologic measures. Make sure to reassess frequently. The rationale, adequate pain control reduce sympathetic response, tachycardia, hypertension, and improve respiratory effort and mobility. Next, monitor for signs of major complications such as excessive bleeding, fever or chills. This is the signs of infection. Flank or abdominal distension may be cause of urine leak or bleeding. Signs of adjacent organ injury, for example, bowel symptom. Durational, timely recognition enables urgent surgical or medical management. For number 7, laboratory monitoring for serial hemoglobin or hematocrit, electrolytes, renal function test as ordered. This is to detect occurred bleeding and assesses renal recovery or function after manipulation. Then, we move to number 8, which is encourage appropriate fluid intake if not contraindicated on it, and follow IV fluid orders from doctor to maintain hydration and adequate urine flow. This can promote urine flow to flush debris and reduce clot or stone fragment aggregation. While patients still recovering in the ward, we should also provide wound and catheter or nephrostomy care using aseptic technique. We need to change dressings per protocol. This intervention can reduce infection risk at SS site. As a nurse, we need to teach patient or family how to care for nephrostomy tube before discharge, such as how to secure tubing, empty or major drainage, aware signs of infection or obstruction, and when to seek help. The rationale to promote proper care to prevent complication and reduce readmission. For the number 11, explain activity restriction and gradual mobilization plan. For example, avoid heavy lifting and follow positioning advice. We should also encourage early emulation as tolerated. This can prevent tube dislodgement and reduce hemorrhage risk. Next, plan for follow-up checkup like imaging screening to confirm stone clearance, nephrostomy removal schedule, and metabolic evaluation if indicated. Rationale is to ensure stone clearance, schedule tube removal, and helps identify metabolic causes to prevent recurrence. Lastly, as a nurse, it's our job to document all information like assessment, intervention, patient education, and importantly about drainage amount or colors, and communication with surgical team. Because accurate records support continuity of care and legal or quality requirements. That's all from me.
Hi, my name is Sita Kalisha. My message number is 24002979. Hi everyone, today we're going to talk about preventive measures that Puan Rogaya can take to reduce the risk of kidney stone coming back after her percutaneous nephrotomy or PCNL procedure. I'll start with the first important measure. First one is hydration. Puan Rogaya should aim to drink at least 2.5 to 3 liters of water every day. Why? Because drinking enough water helps to dilute the urine, which reduces the concentration of minerals that can form stones. This simple step is one of the most effective ways to prevent recurrence. Is dietary modification. Not all foods are created equal when it comes to kidney stone. She should reduce foods that are high in oxalate, such as spinach, nuts, chocolate, and tea. At the same time, she should limit salt intake and too much animal protein because both can increase calcium in the urine and make stones more likely. But it's important to maintain a normal calcium intake. Cutting calcium too much can actually increase stone risk. Another preventive measure is maintaining a healthy body weight. Obesity increases the likelihood of forming kidney stones, so following a balanced diet and regular exercise is key. Even gradual weight loss can have positive effect on overall kidney health. Finally, from my side, Puan Rogaya should monitor her urine output. She should make sure she has at least 2 liters of urine output per day and keep an eye out for any changes like blood in the urine, cloudy urine, or pain when urinating. Any of these occur, she should report them to her doctor immediately. Early detection can prevent complication and the formation of the new stone. That's all for me. I'll hand over to my friend Shamimi, who will explain more about preventive measures.
Okay, thanks, Rashika. Now I will continue with additional measures that are equally important. First, Puan Rogaya should take any prescribed medications exactly as her doctor prescribed. For example, depending on the type of stones she had, she may be prescribed medications like potassium citrate or calcite diuretics. These medicines help prevent stone formation by changing the chemistry of the urine and making it less likely for crystal to form. Okay, next, it's important to avoid dehydration. This means drinking water not just when she is thirsty, but regularly throughout the day. Dehydration, especially in hot weather or after exercising, can concentrate the urine and make stones more likely. Small frequent sips of water throughout the day can make a big difference. Next is follow-up care. It's also very important even after a successful PCNL procedure. She needs to attend all her urology appointments and undergo any recommended urine tests or imaging studies. This helps
The doctor check for early signs of new stones and manage them promptly. In conclusion, by following these preventive steps, staying hydrated, eating a healthy diet, maintaining a healthy weight, taking medications, avoiding dehydration, attending follow-ups, and recognizing early symptoms, Puan Rukayah can significantly reduce her risk of kidney stones coming back and maintain better kidney health. That's all from us today. We hope this helps you understand how lifestyle and self-care play a key role in preventing recurrent kidney stones.